Can you still enjoy travel when you're taking a GLP-1 medication? Yes, you can, and let's talk about just how today. My name is Dr. Lindsay Ogle, and I'm a board certified family medicine and obesity medicine physician. And I see patients all across the state of Missouri at my telehealth clinic, Missouri Metabolic Health. And many of my patients are taking GLP-1 medications, and I have helped guide them through many different vacations that they have enjoyed while they continue their GLP-1 treatment. So let's talk about it. Why should you continue your GLP-1 medication when you are going on vacation? First of all, obesity is a chronic medical condition, and any chronic medical condition, you want to continue to treat it while you're on vacation. Because if you don't, then there could be issues that come up, whether acutely while you are traveling, which is difficult when you are away from your home and your doctors, or there could be complications from discontinuing treatment when you go to restart when you come back home, or because of delays, there could be issues with any chronic condition later on. So you want to continue your treatment for your overall health, both now and in the future. And for GLP-1 medications specifically, I really want to take the chance to highlight here the importance of avoiding interrupting your treatment, because I have seen this with people where they have stopped their medication without communicating that to their doctor, and then they restart their GLP-1 medication at the dose that they were at before, even though it has been several weeks or even months since their last dose, and they have gotten very sick from it because their body's not used to having the medication in its system at that time. So if for some reason you do decide to hold your treatment during travel, especially if it is longer than a week, you really need to communicate that to your doctor so your treatment plan can be adjusted if needed. And then outside of that, it is so beneficial to continue your GLP-1 medication during your travel, during your vacation, because GLP-1 medications help with food noise and appetite control. So instead of spending your vacation constantly thinking about food and worrying about how much you're eating and worrying if that's contributing to weight gain or, affecting your metabolic health, you can take your medication and be present and enjoy the moment. Because I assume if you reflect back on vacations prior to starting your GLP-1 medication, you were often spending a significant amount of time and brain energy contemplating about your nutritional intake during that period. And if you do decide to continue your medication, your GLP-1 medication during travel, and I do recommend that, you will see how freeing it can be and how present you can be and truly enjoy the moment. And that does not mean that you cannot enjoy food, because food is a big part of travel and exploring new cultures and new areas. And I want you to be able to do that. And at the end of this video, we're going to talk about some ways to approach that, to do that in a safe and sustainable way. But it should not be all consuming. There are other parts of travel and vacationing. There is, exploring the new city that you're in. There is talking to your family or your friends, or if you're solo traveling, having that time to reflect or meet new people. You probably want to explore other things other than restaurants. So going to museums or monuments or hiking or biking or other activities that you plan to do on your vacation. There is so much more to do other than eating and drinking during vacation. Although again, that doesn't mean that you can't do those things. So before we talk about the lifestyle recommendations, and I'm also going to talk about some medications that I recommend bringing along with you in addition to your GLP-1, I want to talk about the logistics of bringing your GLP-1 medication with you when traveling. So if you're on a GLP-1, you know that these medications are supposed to be refrigerated, and you keep them in your refrigerator until you're ready for your dose for that week. But the truth is that these medications can actually be safe out of the refrigerator for a period of time. And each duration of time that they are able to be out of the refrigerator is a little bit different, and I will go over that. But I want to highlight a couple of different, important things to note when you do take a medication out of the refrigerator for travel. One is that once you have a medication get to room temperature, it should stay at room temperature. You do not want to travel with your medication at room temperature and then when you get to your destination, put it in the refrigerator. That could negatively impact the effectiveness of your GLP-1 medication. So once it gets to room temperature, keep it at room temperature. And when we say room temperature, it should not go above 85 degrees Fahrenheit or 30 degrees Celsius. So keeping it at what we would, typically consider room temperature or even a little bit higher, but do not exceed 85 degrees Fahrenheit or 30 degrees Celsius. On the other end of the spectrum, you do not want your medication to freeze. That could also negatively impact its effectiveness. And so avoid freezing. Do not put it in a freezer to extend that refrigerated time. That's not going to work. If you're going to really cold temperatures, avoid or make sure you keep it in some sort of storage that's going to keep it at relative room temperature. And it doesn't mean that the medication is going to be dangerous if it does freeze or it does go above that 85 degree Fahrenheit threshold. It just may render it less effective or ineffective, which, especially if you're paying for these medications out of pocket, or even if you're not, having it freeze or get to a higher temperature and having it be ineffective is obviously really a bummer and could lead to issues with your treatment. So for Zepbound single dose vials or pens, these medications can be at room temperature for up to 21 days, so 3 weeks of travel. There is now a quickie pen that has multiple doses in pen form for Zepbound. And then some people also may have access to multi-dose vials. Those versions of Zepbound can be at room temperature for 30 days. Wegovy can be at room temperature for 28 days, so 4 weeks of travel. And if you have any questions about this, definitely talk to your prescriber or your pharmacist, and they will help with guidance with what to do with traveling with your medication. The last thing I would say about logistics is I highly recommend to keep your medication on your carry-on if you are flying or checking a bag anywhere. We know that sometimes things happen and luggage gets lost, and that would be awful if you find out that you no longer have access to your medication. Also, you do not have control over temperature regulation when you check a bag, so keeping it on you ensures that you have it safe and that you have it at the appropriate room temperature. And I guess one final thing with travel, some people do choose to bring their medication with a medication cooler or some other type of cooler to keep it at the refrigerated temperature, which is absolutely okay, and you can do that. And may be required if you're doing an extended travel vacation, but it's not required if you are within those timelines that we discussed for Zepbound and Wegovy. So I want to go over some lifestyle recommendations to think about and adhere to when you are traveling or on vacation to help to ensure that you are both maintaining, your treatment goals and maintaining your metabolic health, but also to ensure that you continue to tolerate your GLP-1 when you're when you are on vacation. Because of course, when we're on vacation, our schedules are not the same as they typically are, and we don't have as much control over what our, nutrition, what our access to nutrition is, our schedules, our sleep schedules may be different, our physical activity level is probably different. So let's go over some things that we may be able to control and get some guideline over lifestyle. The first is one thing that I always talk about, ensuring adequate hydration. So flying, traveling in general, changing our nutrition, these all can lead to dehydration. So making sure you're drinking throughout travel and when you get to your destination is so important to, support your body and to ensure tolerance when you're on your GLP-1. I sometimes recommend and personally bring electrolyte packets to use and to help boost hydration when traveling. So that can be a great tool. I typically recommend the sugar-free options. So that's something that you can just keep with you, those little packets to just add to some water to boost your hydration during this travel period. You also want to limit alcohol. So alcohol, as you may be aware, if you drink alcohol on a GLP-1, you may have decreased tolerance for alcohol. So you may feel a little bit more intoxicated on less amounts. For many people, they have decreased desire for alcohol on a GLP-1. So that's something that is to be noted. But also when you do drink, you have obviously decrease inhibitions and you may steer away from your typical nutrition plan that you are wanting to follow if you are drinking alcohol. So limit the amount of alcohol whenever possible. And as I talked about earlier, food is a major part of travel and exploring new cultures. So it's so fun to try new foods that you don't normally have access to. And I want you to do that. We just want to try those foods in moderation. So continuing to have smaller portions that will support your health goals, but will also help you to avoid side effects when you're on your medication. And you want to pay a particular emphasis with this if you are eating foods that have a lot of fat content, maybe they're fried, have a lot of sugar in them, spicy foods. Those are all common triggers for side effects on GLP-1. So that can lead to upset stomach, nausea, reflux, loose stools. So to make sure you limit those foods or be really cautious when incorporating them into your diet in general, but especially on vacation. Same thing with drinks. Really rich drinks or sugary drinks can be upsetting to the stomach, and people typically when you're on vacation, you may be more likely to have this, whether it's a cocktail or a specific like coffee drink or a local drink that tends to have more sugar or like cream in it. That can be upsetting to the stomach, so being cautious with those is important. And then for physical activity, many people enjoy walking around new locations during travel, and I highly recommend that. It's a great way to see a new area, and that counts as exercise. Walking counts as exercise, so if you are increasing your steps during your vacation, then that's great, and you are getting really good physical activity in. If you want to and have time, doing 10 to 20 minutes of a body weight exercise 2 or 3 times a week can also be really helpful. Many hotels have gym access, so you could always exercise there if you want to incorporate that into your travel as well, to just maintain your motivation and maintain your rhythm as far as activity goes. And many people feel better and have more energy when they're physically active. So again, exercise is not for punishment. It's not to make up for the food that you ate. It is to support and nourish your body. So walking and then plus or minus a couple of exercise sessions or strength training sessions during travel can be very beneficial. Regular exercise might also help with sleep, and keeping as much as possible to your regular sleep routine can also help support you during travel. This can be difficult when you are changing time zones, and that brings me into my next category here of what I wanted to talk about, which is medications to keep on hand when you're traveling. And melatonin can be really helpful to offset to some of that time change that may interfere with your sleep. So taking melatonin to help get you to the local time when you are ready to sleep, and then also when you return home, taking melatonin, ideally a couple hours before, like 2 or 3 hours before bedtime is preferred. And we're looking for anywhere between 2 and 5 milligrams of melatonin can be really helpful to get back into the time zone for your sleep routine. Some people may take a Benadryl for a little bit stronger of a sleep aid, and that is okay. It's not the best thing to take, every night long term, but can be a great tool to use as needed, especially during travel. Other medications I think are great to have on hand are reflux medications. I did a talk last week about acid reflux, so I'm going to include that link here so you can hear all about that conversation. We talked about PPIs like omeprazole, H2 blockers like famotidine, and then Tums as needed. So those are great things to have on hand to help with any reflux symptoms that may occur. We also talked about lifestyle modifications to help with reflux, so check out that video for all of those details. Another great thing to have on hand is Imodium. This is available over the counter that you can take for either if you get traveler's diarrhea, or if the diet changes that you try when you're trying the local food, if that is leading to loose stools, taking Imodium can be really, really helpful. Also, if you are experiencing loose stools, it's very important, again, to focus on hydration. So drink lots of water, and an electrolyte drink can be very, very helpful in these situations to ensure you're continuing to stay up with your hydration, especially on a GLP-1. On the flip side of that, many people may develop constipation when they're traveling, and that can be due to the dehydration that we're mentioning. It also can be due to the diet changes, maybe not getting enough fiber in your diet, and then change in sleep schedule, and then just the change in environment. For some people, that can induce constipation. So you can bring with you some fiber supplements. I also did a whole talk about constipation on a GLP-1, which I will link as well. You can bring fiber supplements, a stool softener, Miralax, stimulant laxatives like Senna. If you take Senna, you always want to take it with Docusate, which is a stool softener. Having those on hand can be very, very helpful. But check out my constipation video for more details on the medication options you can bring, as well as lifestyle things to keep in mind when managing constipation. It can also be helpful to have medications on hand that may manage nausea. Something that is available over the counter is a scopolamine patch. This is especially helpful if you are going to be boating at all during your travels. But many people also get like ginger chews over the counter. Anything with ginger can be helpful for nausea. Doxalamine with B6 is available over the counter. But you can also ask your doctor for a prescription for Zofran, which most people get the version that dissolves under the tongue. So it's really easy to take if you're really nauseous, and it acts pretty quickly, and that can be great to just have on hand. There are some other prescription anti-nausea medications that your doctor may recommend for you. And again, I think it can be helpful just to have on hand in your day-to-day life, but especially when traveling while on a GLP-1 medication. And then last, having access to Tylenol and ibuprofen or naproxen can be really helpful if you develop a headache or muscle aches along the way. So those are wonderful. Most people can take those safely, but if you have any concerns, if you could take it based on your health conditions or your other medications, always talk to your doctor to make sure that it is safe and right for you. So that sums it up for my recommendations on how to manage travel, how to enjoy travel and your vacation while on a GLP-1 medication. I hope you found this helpful. I hope hope it gives you the confidence to pursue travel while on treatment on your GLP-1 medication. I really hope that you're able to be present during your vacation. It's so important to enjoy the moment. Life is short and these vacations are really precious. We all work so hard. So I hope you enjoy your next vacation. If you have any questions, please let me know. You can send an email to support@Missouri Metabolic Health or comment on this YouTube video if you're watching there, or reach out to me via social on TikTok or Instagram. I would love to hear from you, and I hope you have a great week.